Benefits of frankincense for help fight cancer. Frankincense, particularly the Boswellia species from which it is derived, has gained attention for its potential anti-cancer properties. While research is still ongoing and more studies are needed to establish definitive therapeutic roles, here are some potential benefits of frankincense in relation to cancer. Potential benefits of frankincense in cancer support. Anti-inflammatory properties. Chronic inflammation is a known risk factor for various types of cancer. Frankincense contains boswellic acids, which have demonstrated anti-inflammatory effects that may help reduce inflammation in the body and contribute to cancer prevention or management. Apoptosis induction. Some studies suggest that certain compounds in frankincense can induce apoptosis, programmed cell death, in cancer cells. This process is crucial for preventing the proliferation of cancer cells. Inhibition of tumor growth. Research has shown that frankincense extracts may inhibit the growth of certain tumor types, including breast, prostate, and colon cancers, by disrupting the signaling pathways that cancer cells use to grow and thrive. Anti-metastatic activity. Some studies indicate that boswellic acids may hinder the ability of cancer cells to metastasize, spread to other parts of the body. This potential may contribute to improved survival rates in cancer patients. Enhancement of chemotherapy. Preliminary studies suggest that frankincense may enhance the effects of certain chemotherapy drugs while potentially helping to reduce their side effects. This synergistic effect can be beneficial for patients undergoing conventional cancer treatments. Immune system support. Frankincense is believed to support immune system health, which is crucial for cancer prevention and management. A strong immune response can help the body detect and eliminate cancer cells more effectively. Antioxidant properties. The antioxidant properties of frankincense may help protect cells from oxidative stress, which is a contributing factor in cancer development. How to use frankincense for cancer support. Aromatherapy. Inhaling frankincense essential oil may promote relaxation and reduce stress, which can be beneficial for overall well-being during cancer treatment. Topical application. Diluted frankincense oil can be applied to the skin, after consulting with a healthcare provider, particularly to areas of concern, to potentially target localized support. Dietary supplements. Frankincense supplements are available. However, it's essential to consult with a healthcare professional before adding any new supplement, especially for those undergoing cancer treatment. Precautions. Consult healthcare professionals. It is crucial for individuals with cancer to consult their healthcare team before using frankincense or any alternative therapies, especially when undergoing conventional treatments. Quality and purity. Ensure that any essential oils or supplements used are of high quality and free from contaminants. Allergic reactions. Be cautious of potential allergic reactions, especially when using essential oils on the skin. While there is promising early research on the potential anti-cancer properties of frankincense, it should not be viewed as a replacement for conventional cancer treatments. Rather, it may serve as a complementary approach that supports overall health and well-being. Ongoing research will help clarify the role of frankincense in cancer prevention and treatment. Thank you for watching. Please like, share and subscribe.